I just want to remind us all, the mind is like a parachute. It only works if it's open.
We need to call a meeting of our skilled virologists, epidemiologists, students of biology and chemistry. And we need to look at not only what they give us, we need to give ourselves something better. So my teacher told me, don't speak for some, speak for the whole. And now I'm speaking for Black America, for Hispanic America, for the Native American, and for those who are desirous of life. They're making money now, plotting to give 7,500,000,000 people a vaccination.
Yes, that's right.
Dr. Fauci, that's why your world is coming to an end quickly, because you have sentenced billions to death, but God is now sentencing you to the death that you are sentencing to others. Yes, Allah is great.
Yes, sir.
So whether I'm present or absent, the Executive Council of the Nation of Islam must call our scientists.
Yes, sir.
Come and let's sit down.
Yes, sir.
Our virologists, our epidemiologists, those of us who know the science. We cannot let them bring anything to us that we don't dissect.
Yes, sir.
Don't you take a vaccine unless you say
Yes, sir.
to our people, we've checked it out.
Yes, sir.
And you better be of the truthful ones.
Yes, sir.
Well, good evening, everyone. It's a pleasure to be here. I've worked with Brother Muhammad with the Circle of Brotherhood for a few years now. And he asked me to talk about COVID vaccines. I wasn't sure how much time I had or how much background information you have on the whole process. So I have a video, which in about 5-6 minutes, it tells you everything about COVID.
In December 2019, the Chinese authorities notified the world that a virus was spreading through their communities. In the following months, it spread to other countries, with cases doubling within days. This virus is the severe acute respiratory syndrome-related coronavirus 2 that causes the disease called COVID-19 and that everyone simply calls coronavirus. What actually happens when it infects a human, and what should we all do? A virus is really just a hull around genetic material and a few proteins, arguably not even a living thing. It can only make more of itself by entering a living cell. Corona may spread via surfaces, but it's still uncertain how long it can survive on them. Its main way of spreading seems to be droplet infection, when people cough, or if you touch someone who's ill and then your face, say rubbing your eyes or nose. The virus starts its journey here and then hitches a ride as a stowaway deeper into the body. Its destinations are the intestines, the spleen, or the lungs, where it can have the most dramatic effect. Even just a few coronaviruses can cause quite a dramatic situation. A pandemic is slowed down by the right responses, especially in the early phase, so that everyone who gets sick can get treatment and there's no crunch point with overwhelmed hospitals. Since we don't have a vaccine for corona, we have to socially engineer our behavior to act like a social vaccine. This simply means two things: not getting infected and not infecting others.
Most flu vaccines, based on season to season, sometimes only works about 50% of the time. So based on how vaccines work and this type of virus, it is really hard to say we're going to get a vaccine that's going to just wipe out this infection. It is not going to be like how we do tetanus. It's not going to be like smallpox. It's not going to be like so many of the other vaccines that we have that works very well, especially ones that work in children. we know that this vaccine is going to be very tricky. It's moving very fast. It doesn't absolutely mean that it's bad that it's moving fast, but it does mean that it is concerning that they may not have enough data to actually say we're going to get the greatest vaccine.
Sure. Well, thank you for having me, first of all. My name is Armin Henderson. I'm an internal medicine physician at University of Miami, and I also run a crisis response team that basically, responds to vulnerable communities during crisis. Usually we respond to hurricanes, but in this instance, we did respond to the pandemic, specifically focusing on Black and brown people in low-income communities throughout South Florida, and then some of the homeless population that live in Overtown and downtown Miami. I do want to speak to the dangers of fast-tracking a virus, a vaccine so fast. One of the things that I do know is that when people go through the whole scientific theory, to whether it's a vaccine or whether it's a research trial or a drug that someone's going to get to cure some sort of disease or something, it's supposed to go through rigorous research beforehand. And I know the stakes are high around the death and the destruction that the virus has already done, but in fast tracking this virus, we kind of, the vaccine, we put people potentially at more harm than we do actual, than not being at harm, basically. And given what I know about the government, given what I've seen around, the FDA, who normally is supposed to be a nonpartisan organization that's supposed to keep us safe when it comes to, different things, whether it be food or drug trials, et cetera. Right now, it's become very political because not only do we want to, save lives, but we also want to make our president look good. And in every other aspect of his presidency that we've actually seen, whether it be in the banking industry or other industries where he's supposed to have like watchdogs that are nonpartisan, he's had people there that have his best interest at heart. So I just want to make sure that we're being cognizant of that. So I think that those are the two conflicting things that are going on at the same time, as well as the fact that, a lot of Black and brown people, rightfully so, have a lot of mistrust of the government when it comes to things like this. And so, without going into the whole history of the way why, the reason why medicine is very racist and built on white supremacy, we also want to keep in mind that there are some good things out there when it comes to medicine, and we need people like Dr. Holder, like myself, and other experts within the field to actually make sure that these things are vetted and safe for our people as well. And I'll leave it at that.
I do hesitate to give my patients vaccines when they first come out. I usually allow other doctors to use their patients as guinea pigs, as bad as that might sound. If they're going to use it, their patients are just going to be the guinea pig. So I don't typically jump on a vaccine, but the stakes during my lifetime as a pediatrician have not been this high. Obviously, this is a new circumstance.
I want to share with you a different perspective. I've seen how the COVID traveled throughout America, but I want to give you a perspective in Bermuda, because right now we have 0 cases. And we have not so many deaths. And that is because our government policy acted quickly, and we closed the borders. We closed all ships, all planes. We gave a week for students to come from London and to come from America to come back home. Our cases came from London, to be honest. It didn't come from America. But what we did was we put everybody on quarantine for 14 days. And we test vigorously. We test 7 days, 14 days, 21 days. We've now opened our borders, but we've opened our borders to certain cities. So we have a list of cities where planes can't come here, we can't go there. So we're looking at a vaccine to fix our situation instead of dealing with educating the public on how to eat healthy, how to eat to live. Go root cause. so that we don't have to follow and be at the beck and wing of vaccinations, because we do have a cure, and we were given a cure. We were given how to eat to live. And I think that if we make that public policy, or do our part to make it public policy in our community and inform our people, that I think that would be a better treatment than constantly looking for vaccines.
Until people are dying by the millions, vaccine is not really going to do anything. My perspective is we need to strengthen our immune systems, and that we as a people actually have strong immune systems. Although the weakest of us, the ones with the poorest diet, the ones on the lowest rungs of the socioeconomic ladder, the ones with the poorest health, specifically here in Florida, Black men eat less than 3 fruits and vegetables a day. So we have to change that. So, and we need to change that not in response to COVID-19, but just so that we're going to be around 3 or 4 generations from now. And I think that's where I would go in terms of educating people on how to build their immune systems, how to protect themselves. Because no matter whether it's MERS, SARS, or any other virus, it's still transmitted the same way, which is hand to mouth.
Brother, Dr. Jabril Muhammad, human molecular geneticist at Population Sciences at City of Hope campus. Brother Jabril?
Assalamu alaikum, family.
Walaikum salam, sir.
So a little bit about myself. I'm a human molecular geneticist with a background in virology. A lot of my experiments that I dealt with prostate cancer in my dissertation years had a lot to deal with interferon. So I have a lot of experience in innate immunity response and how viruses regulate that system, right? So there's a lot of things that were talked about today, and I appreciate the presentation. When we talk about vaccines, there's another element that we haven't talked about, and that's as far as interferon or medication, right? And Dr. Love spoke on it briefly, and he talked about it mutating. Vaccines addressing something that mutates. We have data that supports thus already. The coronavirus, or the novel coronavirus, has already reached beyond 30 strands internationally. Nationally, when it first hit the shore, when it first hit America, it was already known that the East Coast had 2 different variants and the West Coast had 1. Even in conversations up to this moment, they're talking about a strain that persists, that seems to be more infectious, but seems to be less virulent and deadly. This adds a level of complexity to the conversation, because now we're talking about something that has the ability to mutate at such a high rate that we're almost comparing it to the flu, right? And the flu is detrimental because it by itself is one of the most prominent viruses that mutates annually. One of the quickest viruses that we've had that pretty much mutates annually, right? And even vaccines for that, it's very difficult because you have to predict the next year pattern that may exist, right? So if you are creating a vaccine, even as fast as you're doing it, trying to mesh together the 3 different phases to kick something out quick, I would be hard pressed to understand how are you going to address the fast mutation rate of something that has already reached beyond 30 strands internationally.
But I've been a Pan-African organizer for the last 30 years. And back in 2006, working with the Howard University Medical School, as well as other students, and the AME Zion Church, which I grew up in, we started the People Before Profit Community Healthcare Project, which was modeled after and inspired by the Cuban healthcare system. Our goal primarily was to create a pilot project that could be duplicated around the nation, where we create an entity that can go into the community and really be advocates and provide information to people, because all the different things that we're mentioning here, as I heard many have said, could be meaningless if people don't trust the people that are sharing the information with them. And the great thing about the Nation of Islam is the fact that the level of respect that the nation has always had in our community is paramount in this. But what we did was we earmarked a 5-block radius around Conti Amy Zion Church back from 2006 to 2011. And working with medical students, we actually went door to door on a regular and recurring basis, knocking on doors, sharing information. And because we are here in Washington, D.C., consistent with a close proximity to, at that time, what was called the Cuban intersection. At that time, they didn't have an embassy. We were able to bring the Cubans in for the first time, I believe, in the history of the Amy Zion Church. We actually had the Cuban representatives come to the church and talk about what they were doing around the world. And it was at that time that they also shared the fact that they were offering free scholarships to people of African descent and Caribbean descent and Native American to go to Cuba to become doctors.
I agree that we need to do some of the basic protection. The vaccine, like the medical student said, it's not going to be panacea. We still have to find a way to flatten the curve and protect the most vulnerable around us and look at ways we can prevent. There's some data coming out on vitamin D, and that may be one of the issues. We got to make sure vitamin D levels are sufficient. We don't hear enough of that. How can we protect our population? Properly, good vitamin D levels and protecting, using masks and protecting yourselves might be more effective than the vaccine, because your vaccine might be 30 to 50% effective, yet the other ways may work. Because a lot of these folks died because they were sick before the vaccine showed up, and all the vaccine did was accelerate the death. We already have too many folks dying early that the vaccine just highlighted. So we do need to get our communities together, vote, get universal health coverage, get better nutrition, look at our vitamin D levels, and mobilize for really good research. And don't accept anything less, because vaccines can work, but they have to be done well. Maybe this rapid betting on a company that has never produced a vaccine may or may not, but I think we should ask them and hold them accountable before we decide that we're going to accept standard research.
That's right. That's right.
When we know diet, exercise, giving us some health care coverage, we could all stay home from work for 2 weeks and get paid, then that would be even better. Come and give us better housing, that we wouldn't be packed in. So there are a lot of solutions that the $7 billion they just spent on vaccines could have worked by just getting better housing, better access to quality foods, and some better health care. So I think as a community, we need to work toward that.
Right. So supplementation is very important, and the levels that she talked about is equally important. And as far as the zinc, data definitely shows that cold virus, zinc as a mineral, blocks the replication of the cold virus. This is something that most people may not be familiar with, but 40% of all common cold cases are due to the rhinovirus, 20% are due to parainfluenza, and 20% is due to the coronavirus. So the reality is that we know that zinc blocks the replication of the common cold or whichever virus may cause it. We may not be able to say for sure that it blocks or has an impact on the novel coronavirus, but we are sure that previous coronavirus strains that we've come in contact with, it has blocked the replication of it, and it may be important to add to dietary supplementation as well.
So we have a lot of work to do to work with doctors and physicians and scientists and clergies and the political realm. This is just the beginning.